One of the most common calls I get here at Souders & Associates is from somebody who says, Holly, I'm turning 65, but I'm not ready to retire yet. Do I have to sign up for Medicare, or can I just stay on my work insurance? The answer isn't a simple yes or no. It depends entirely on the size of your company and what you're paying for your current coverage. Hi, I'm Holly Reichard, and today we're talking about the working senior strategy. We're going to look at the rule of 20, the hidden dangers of HSAs, and how to decide if staying on your employer's plan is actually saving you money or costing you a fortune in the long run. The very first thing you need to check is your company's size. In the Medicare world, we call this the rule of 20. If you work for a small company that's fewer than 20 employees, Medicare is generally mandatory. In this case, Medicare becomes your primary insurance. That means your work insurance will only pay after Medicare has paid its share. If you skip Part B, your work plan might refuse to pay that bill entirely, leaving you with a massive financial headache. However, if you work for a large company with 20 or more employees, your work insurance remains primary in this scenario. You have the option to defer or delay Part B without any late enrollment penalties. This can save you that $202.90 monthly premium while you're still drawing a paycheck. This may be a good call to delay if your work insurance is meeting your needs. Now let's talk about a detail that trips up a lot of people, the HSA or health savings account. If you have a high deductible health plan at work and you're still contributing to an HSA, listen closely. You cannot have any part of Medicare and still contribute to your HSA. Even just signing up for premium-free Part A will trigger a tax penalty if you keep putting money into that account. If you love your HSA tax breaks and want to keep contributing, you generally have to delay all parts of Medicare. But be careful. If you sign up for Medicare after age 65, Part A can be retroactive for up to 6 months. I always tell my clients to stop their HSA contributions at least 6 months before they plan to retire to avoid any surprises from the IRS. If you're not on an HSA, I would advise joining Medicare Part A. It doesn't cost extra, but it does offer an extra level of coverage if you're being hospitalized. Your work insurance is primary, and then Medicare is secondary. So if you were hospitalized for a few days, your bill would be no larger than $1,736. Just because you can stay on your work insurance doesn't mean you should. I help my clients run a pro versus con comparison. Think about your current work plan. What's your monthly premium? What's your deductible? How much are you paying for you or your spouse? Is your spouse able to sign up on other health coverage? Many times, employer plans have high deductibles of $3,000 or $5,000. Contrast that with Medicare Supplement Plan G, where your only medical deductible for the entire year is $283. I've had many clients realize that even with Part B premium, switching to Medicare actually saves them thousands of dollars in a year, out-of-pocket costs, and gives them better access to their doctors. If you go to the doctor frequently or have a planned surgery, it may make sense to join Medicare, even if it is a higher monthly premium than your work insurance, because your out-of-pocket for medical services will be considerably lower. One last thing you must check is your prescription drug coverage. Every year, your employer is required to send you a notice telling you if your drug coverage is creditable. This is a fancy way of saying as good as Medicare. If your work plan is not creditable, you could be racking up permanent late enrollment penalties every month you wait. If you get a letter saying your drug coverage isn't creditable, give us a call immediately. We can get you a standalone Part D plan to stop those penalties in their tracks. Deciding between Medicare and work insurance isn't a one-size-fits-all choice. It's a math problem. I often tell people the threshold is about $250 to $300 a month. If you're paying that much or more for your work insurance, it's likely a good idea to go ahead and join Medicare, even if it costs a little bit more a month, because it's significantly better than most work insurances. I even advise that number for healthy people. You can be as healthy as a horse, but that doesn't stop someone from texting and driving, hitting you, or you slipping on an icy step. If you're approaching 65 and still working, don't just default to your employer plan. Let's sit down and look at your specific benefits compared to what Medicare has to offer in 2026. As an independent agency, we specialize in the behind-the-curtain comparisons to make sure you're making the smartest move for your wallet. Give us a call at 316-682-1791 or visit us at soudersandassociates.com. I'm Holly Reichard. Thanks for watching, and let's make sure your transition to Medicare is a smooth one.